Step 1 of the routine is to do 1 second of clenching and 1 second of relaxing. You're going to work up to doing 10 of these in a row. So 1, 2, 3, 4, and lightly. So you'll start with doing a light squeeze, and then you'll move your way up to, over a matter of weeks, longer, harder squeezes. During the first week of doing PC exercises, only do 1 set of these 3 exercises every day, and do it gently. Start lightly. So the way you do that is by paying close attention to your level of arousal. Once you get close to the point of no return, aka ejaculation, you're going to squeeze on your PC muscles. Take a deep breath in, all the way down to your belly, and out. And as you are doing that, you'll notice a wave of sensation coming up from your genitals and coming back down throughout your body. It could feel tense, it could feel pleasurable, it might feel just like really exciting and kind of confusing. That's awesome. Just let it happen. Let it wash over you like an ocean's wave and let it move through you. After that happens and the stimulation has died down a bit, you can start to stimulate yourself again. It's really important that you squeeze about 5 to 10 seconds before you would ejaculate. Otherwise, you run the risk of ejaculating anyway. That's why I to keep in mind. Number 1, squeeze only the PC muscle. Don't squeeze your anal sphincter. Don't squeeze other muscles in the area. Don't squeeze your low abs, your thighs, your glutes. Only the PC muscle. Take it easy. Don't go too quickly. Again, this is something you can do for the rest of your life, so you don't need to be in any kind of rush to strengthen these muscles. If they haven't been getting a lot of attention over the last several years, then they're probably not in really great shape. Treat them with the respect they deserve. Results if you treat them well from the very beginning. As you're learning this technique, do not squeeze your PC muscles while you're masturbating. You'll notice that that's one way that men build up sexual tension in order to reach the point of ejaculation. You want to keep those muscles totally relaxed the whole time that you're masturbating up until you start to reach the point of no return, at which point you can squeeze them. Otherwise, you might actually ejaculate faster because they're really great at holding tension and keeping pleasure and sexual excitement in the genitals, and that's not great for ending premature ejaculation. If you know
On exhalation, squeeze the muscles around your anus and imagine you are trying to stop yourself from passing wind. The feeling is one of a slight squeeze and lift around your back passage. Hold the contraction for the required length of time, and then relax your anal sphincter muscles. Try to avoid holding your breath, squeezing your legs together, or tightening your buttocks. This will help to isolate and strengthen the back of your pelvic floor muscles.
Your Kegel exercises correctly. I want you to think about trying to shorten or withdraw your penis inwards towards your body. Try now where you're sitting. Can you feel that action? It's a really small, subtle movement. Try again. Don't worry, your penis isn't going to get shorter. Just try to think of this as a way of improving your muscle control. If you hold your fingers around the base of your penis, you may be able to feel the muscle that wraps around it contracting as your penis moves slightly inwards and towards your body. Now next, I want you to imagine that you're trying to stop or slow the flow of urine and contract around the base of your penis and then relax. Now try to put the steps 1 and 2 together. Shorten the penis and try to stop the flow of urine. And now relax. Now here's the final part to getting that exercise correct. Try to tighten your anus as if you're stopping gas from passing. And this is the back part of your pelvic floor. You should feel your anus tighten, but your buttocks should stay relaxed. So you shouldn't be moving up and down like that in the chair. Buttocks stay relaxed and the anal sphincter tightens and squeezes. Let's now combine all 3 steps. This is the correct Kegel exercise. So sit up, lengthen your spine to sit tall, keep the inward curve in your lower back, breathe normally, and now think to shorten your penis, stop the flow of urine, and tighten your anus together all at once. Can you keep those pelvic floor muscles contracted and keep the hold? Try to keep your belly relaxed, keep your breathing normal if you can, And hold that contraction for a couple of more seconds. And now let your pelvic floor muscles relax back to their resting position. How did you go with that exercise?
Allowing this perineum to stretch. Hold the stretch 15 to 60 seconds. And you may feel this stretching here. Just relax if you do and hold the stretch. If you don't feel this, while you're doing this, I want you to make sure that you're breathing and relaxing. Either your ankles or your calves, whatever is most comfortable for you. And then you're going to just slowly let your legs drop into the stretch. So you'll feel this mouth and just.
So Sarah, if you want to come down into basically your child's pose or shell stretch, and the knees can be as wide as you want them to be, and then you're just going to breathe into your back. So take nice big full breaths in here to get these muscles nicely stretched out. And then Sarah's also thinking about stretching right down through to the glutes, because she wants to open this area up and have a nice release through the rear pelvic floor.
Oh, I don't want to take the time to go get my yoga blocks or to go get my pillows or props. I can promise you, when you get them and when you feel how supportive they feel and how released they make you feel, you're going to one, and then exhale. Pull out your hip joints. So stirring the pot is what I like to call this. It's like you're stirring a big vat of chocolate or something fabulous with your legs as stirring sticks. So use your arms to make this movement happen. The legs are just kind of going along for the ride. This should feel really relaxed and not like a stress or a strain. Go the other way. Just breathing steadily and treat. Hold on to the outer ankles actually. Hold on right here and flop your knees apart. This is called frog stretch. And really relax into this. Your tailbone down. So your tailbone is pressing toward the ground down low, and your knees are coming down toward your yoga mat on both sides. Of this that's going to really stretch all along the outside of this thing outward. You can have this right arm out to the side, and you can look toward that right hand, or you can look toward that right knee. And you should feel this right. You might have seen these moves. They're really nice exercises to do to just relax and release the pelvic floor. Not really. But you know what I mean, I'm sure. So relaxed on the top and relaxed on the bottom too, but pushing it just a little bit. Push the envelope just a little bit. And think about breathing also expanding into your low back. And I want you to feel pelvic floor tension.
Push your belly button one way and then push your belly button the other way. And you'll just feel a deep stretch all through the groin, but then also you can feel a stretch just around the sitting bones as well, which is where the stretch needs to be the most. What you can also do is just use your breathing. So by taking a breath where hip. So again, you'll mostly feel a glute stretch behind the hip, but there are connective tissue attachments around. Explore by moving your body in different directions.
And then bring the knees into my chest like this. You can hold on behind the thigh if your knees are sore, or you can hold on around the front of the shin. And again, just breathing out and relaxing with the stretch. And I'll take the leg down, and I just want to show you on the other side. Guide the leg in towards your body, towards your chest. Important that you keep your lower back on the ground there, and again, just breathing out with the stretch. Leg back. I need to raise my right arm high above me and tilt slightly to the left. And that's how you'll stretch both parts of that muscle. Let the anus lower down and breathe out slowly. This takes a bit of practice. Let's go one more time. Breathing into the belly. Visualize the sitting bones. Visualize the area between the sitting bones and lowering that area down, and visualize allowing yourself to pass gas. You can feel the anus move down slightly. And then slowly release.
Yeah, but when you start to feel tired on this one, let off. Just let off. Give it a little bit. Go again. Give that 5 or 6 reps. After that, that's where I want my heat. That. I'm gonna switch sides. I'm gonna do the other foot. 2 minutes. Like so. Keep them on there. Straighten them out. You do not want your pelvis rolling back. You want it level. And if that and you may be down here when you start. Hold it. If you want, look around, stretch out your shoulders. Degrees, maybe a little more as I push my hips forward, but not too far. Therapist may give you.
So again, breathing and stretching. So here we're getting a nice stretch down with men and women with muscles beforehand. And four. Close your eyes. So just trying to get the patient to focus on a nice long in-breath and a long out-breath. You're just trying to slow that breath down, deepen it, lengthen it, and out. And what we're looking for here really is for the diaphragm to move. We want that diaphragm to descend, and then as a result, the pelvic floor to release. So I often say to the patients before they start their stretches to do 8 to 12 release breaths through the tummy and pelvic area. And then once they're in their stretch position, to add the breath.
Larger surface area, it does help to spread the pressure out over a greater area. So instead, we will use this still very soft, very pliable ball to sit on and have that under your perineum to start with again. So how does this one feel for you compared to the smaller one?
It's a lot easier. Yeah, it's level 1.
Yeah, so this might be a lovely place to start for most people. And then working up toward a smaller ball for some more specific release. So on this ball now, can you try some of those pelvic movements again? So we've got tilting, rocking back, and then rocking forth. So we had tucking the tailbone under at the back, and then creating a little curve in the lumbar spine as you go the other way. Great. How about now some of that circular motion, hula hooping?
It's a lot easier to do.
Yeah, so this ball does allow a lot more pelvic mobility, which is also a great way of restoring some of that functional movement.
Especially if you're a man doing this. But you can take your ball just around the sitting bone, and then you can give yourself a massage. So I sometimes bring in the tennis balls to yoga class as well. And they're just a wonderful tool for self-massage. And if we find any kind of tension, they're just perfect. So that is it. Bite.
What position my fingers are in, and then most
pain and to